Loading and almost there. Yes, I think it's working. I have a message in German, so not sure. But give me 1 second just to verify. Okay. I will just send this to Steph. Okay. So, hello everyone. Welcome to Neuroccino. I'm just verifying if it's working. Perfect. So we are in live in YouTube. So it's 9:32 on this Monday morning, and Eva already shared the paper she will present today in the chat, so you can open it. And so yeah, it's the main paper I think is related to Alzheimer's, and then she also will discuss in relation to other diseases. But yeah, so Eva, the floor is yours.
Okay. Yes, so I'm going to be showing you this brief report on the use of ultrasound to open the blood-brain barrier and better be able to administer drugs for Alzheimer's disease. I think this paper is from January, and it's very short, but as Marcela mentioned, I have a couple of others for some examples. But yeah, I'll jump right into the methods. They were able to recruit 3 participants for this who had mild cognitive impairment due to Alzheimer's disease. And they went through an intervention and a follow-up phase. And in this intervention phase, for 6 months, they had monthly infusions of the medication that was followed by focused ultrasound 2 hours after in order to open the blood-brain barrier. And they did this ultrasound only in one hemisphere, in the frontal or the temporal lobes, or the hippocampus. This way they could use the homologous brain region as a control and compare what the difference was like with the opening of the blood-brain barrier and only with a medication which is a standard of care. And this is also what they got during the follow-up phase. They just received the medication alone for some months. And they also made sure to verify if this blood-brain barrier was closing again, because you can imagine if this stays open for too long, this can be dangerous. So here they used MRI with gadolinium contrast. You can see in this figure the baseline scan, then the selected area for the focused ultrasound. And immediately after, we see these white lines, which suggest that the brain barrier is open. And after 48 hours, we see a normal scan again. So yeah, they verified that this is closed. But of course, this window is a dangerous window. And you may be wondering at this point, but how does really ultrasound open the blood-brain barrier? And for this, I have taken some pointers from another very recent study where they review different methods to treat gliomas, and they explain very well the method. So just for a visual, the blood-brain barrier basically consists of these endothelial cells that are separating the vascular system from the rest of the brain, and they are very tightly joined with via these tight junctions. So if we want anything to go through, we have to engineer it with some specific properties like low molecular mass, which just really complicates the therapies that we can administer. And what focused ultrasound can do is open this blood-brain barrier when it's combined with the use of microbubbles. These bubbles were already used as a contrasting agent because they have air inside, which we can very well see with ultrasound. But if you apply specific frequencies, you can make these microbubbles expand and contract, and this mechanical force puts pressure on the vascular system and is able to open these tight junctions a bit, and larger molecules can go through without having to go through the specific transporters here. So yeah, back to the main paper. They show the results first for the amyloid concentration. They actually saw quite a reduction in the amyloid levels. This is a PET scan only of participant 3, but they also show one for participant 1 and 2. And yeah, the more red it is, the higher the levels of beta amyloid. And you can compare with the contralateral side. Here, the one delineated with white is the one that received ultrasound, and the reduction is visible to the naked eye, let's say. And to have some more numbers, participant 1 had nearly, well, 1 and 2 had nearly 50% more reduction with the use of this technique than only with the medication, and participant 3 went up to 63%. And here we can see a more week by week, or every few weeks, they did scans, so we can see the progression of this reduction. It's not as linear for the other 2 participants, but it's always a greater reduction with the use of this technique. And yet these are the centiloid values that still represent yeah, and I think this is pretty much everything that they measured, but they also, for risk management, also monitored the cognitive measures of the participants. They were not powered to really assess the cognitive impact of this technique, but just for safety reasons. So there was no cognitive decline during the treatment phase, but for one of the participants in the follow-up phase, they did see a reduction in the Urbans score as well. Sorry, only in that one, but not in the one that is specific to Alzheimer's disease, the activity of daily living inventory. And for adverse effects, it was mostly headaches that was reported, also some neck pain in one of the participants, but you can imagine that being, with the fixation and the stimulation, it's just a very rigid position to be in, and this is to be expected. Participant 3 also had mild behavioral symptoms like agitation or sleep disturbances, differences in appetite. Yeah, and they have a very short discussion, but basically previous studies had already tried opening the blood-brain barrier for Alzheimer's, but they did not combine it with the medication. So only with ultrasound, they were able to reduce beta amyloid levels up to 6.6%. But when combined and using the same measurement, in this study, they can do 32% decrease. And this is consistent with some animal studies that showed 5 to 8 times more penetration of the drug when this ultrasound is applied. But this is all the background they could give. And I also wanted to show you that this technique is being used in more fields, as you saw in glioma with the paper before, but this is also for Parkinson's disease, where they showed in rats how this technique can be used for gene delivery, and where they specifically evaluate if there are detrimental effects, because apparently they saw that first there was an impact on dopaminergic neurons they were using. But then in this study, they see that after a while this recovers and it's not a problem. So yeah, I hope you got excited about this technique. Clearly has to be evaluated case by case if this is viable depending on the area, what you want to do. But I think it holds a lot of promise. I was surprised by some things in this paper, specifically the amount of reduction. Maybe you can explain this better to me because yeah, we see reductions of 158 centiloids, for instance. And as I understand, the centiloid scale goes from 0 to 100, and 0 is the level in a healthy brain, and 100 is the level in the typical Alzheimer's brain. So it's really a huge reduction to suddenly have hyper healthy levels of beta amyloid, I guess, after this treatment. So that surprised me a bit. But yeah, that's all I have for you today. I hope you liked it. If you have any questions, I hope I can answer them, but I'm very new to this as well.
Thank you very much, Eva. Very interesting. I don't know if there are some. Yeah, already we have one question from Lily.
Hi, thanks, Eva. A very interesting paper. I mean, I have several questions. First, I didn't understand when you are using ultrasound stimulation. Are you opening or actually kind of killing the brain blood barrier and then it recovers by itself?
In theory, you are opening. Yeah, that was my impression because yeah, where the cell is joining with itself or another cell, here this is the area where by putting a bit of pressure this could slide or easier. I don't think that they're doing enough to really break it, and that would be more dangerous. I believe this is why we can see a quick recovery within 24 hours. But I guess it's possible that they're also doing further damage if this is not very.
And it is pretty localized, so wherever you do it, there will be the opening. It's not gonna spread all around the brain. I don't know.
No, it's yeah, it's pretty localized. I was actually surprised to see that the area is so large because they have like 100 or 1,000 of these. Let me just check here. Well, sources that are all focusing on one point. So yeah, 1,000, you can see it here, sorry. 1,000 ultrasound sources that converge in one point. So I guess they're moving it through that area in that time. Because otherwise, I don't know how they got such a large area.
And did we know this before approving to use it in humans? This method, like that it opens a brain barrier, or is it something a recent finding that actually it opens it up?
I think it's been used for some time, the opening. I don't know how long exactly, but no, it's been some years that they have used it in this way. It's just a combination with different drugs, and everything needs to be very well tested before they take it to humans. But for sure, this technique has been around for longer, I think, especially in animal studies. But they did have to get a specific permission to use this in this trial because it's not an approved use.
And what is this medicine exactly? Is it just is it something that they've been trying to use it before opening as well? And
yeah, I believe it's the standard.
Is it a famous drug for Alzheimer's disease that they try to use to cure it?
I don't know if it's famous, but apparently it is the standard of care in the US, I guess. So it's just used to reduce the beta amyloid levels, but I didn't look that much into the drug. I'm sorry. But yeah, they do mention it's the standard of care that they only can do. But I didn't see really what the effects of only the medicine can be.
Do they also sorry, I have a lot of questions. Do they also was it only one patient of certain age? Are they discussing some possible problems if you choose another stage of Alzheimer's disease, like late stages, it will not help, or it's just they took one. Yeah, I see. Yeah. I don't know, two patients.
They have three. So
Okay.
they are 77, 59, and 64. And they did screen for something, so only sort of a mild stage, and also that they didn't have any imaging abnormalities that you can see sometimes in these patients. So they reduced it a bit because they only had 3 participants. But their discussion is really, it's a brief report, really. They did not touch on what could happen if in different stages, or I guess they are going to continue. They are doing the follow-up for 5 years, so maybe then so we will see more changes and they will apply this to more people.
So they also didn't. No, they did follow up, I see, or not? Like 6 months later, yeah.
6 months was the treatment, and then they did the follow-up phase.
Yeah. Okay.
Yeah, some time after, but it's scheduled to be for 5 years, the follow-up.
Ah, interesting. Yeah, very cool. Thank you.
You're welcome. Sorry, I don't have the answers.
Great. Chris?
Yeah, thank you for presenting that. It's so far from my domain, so that might be a stupid question comment. But if when they open the blood-brain barrier, the drug is doing having a bigger effect, that means that they were still giving this drug to have this effect, but to a lower degree, right? So that means that the drug was still passing the blood-brain barrier to some extent, isn't it?
Yeah, I think the drug is engineered to, have some effects, but you can see in these that in some, well, they even see an increase, which, I mean, it's only
but
3
it
participants,
increases
but
with time anyway, right? If you don't do anything.
yeah, so this is without the drug. There's already a slight decrease here, 8.5.
Yeah.
So in the
yeah, so does that mean that it would allow because I guess if they want this specific effect of reducing the amyloid plaques in the brain, if they wanted to remove them completely, they would need to load with the drug, but I guess that would be dangerous because to get only a tiny proportion of the drug passing the blood brain barrier, they would need insane quantities. But with that technique, maybe they could use similar quantities, but I mean that could still be toxic for the brain, I guess. But maybe that would help reducing the doses in the rest of because of course if it's in the blood it will flow through the entire body, so that would reduce the doses that are necessary to have the effect.
yeah, absolutely. I think it's both being able to reduce dose and also being able to have more freedom when designing these drugs, because you are not constricted by what is going to be able to get through the barrier.
Yeah, you might reduce the effect.
But you have less levels of toxicity and etc. I guess they also have to see how far they want to go with this cleaning, because precisely here, like, the reduction is huge in the scale that is supposed to be between 0 and 100. And yeah, so at the participant level, okay, you see your brain has been cleaned, at least in some areas, but you have no improvements personally. Maybe in a bigger group we could see them, but it's yeah, I don't know. Whether
But
this
is
beta
it
amyloid
clear
is
that
causing
amyloid plaques are the cause, or is it
exactly.
just a symptom?
Yeah, exactly.
There's
This
that
is
too.
a debate, and it's
Yeah.
yeah.
Thank
I
you.
think there is more and more reason to believe it's not really a cause, and then how much this can help or not is seen. But such huge reductions, I think, help to also investigate this.
Cool.
Yeah, good
Thank
point there
you.
about reduction.
Yeah, actually, I had the same question than Chris, but perfect that he already asked for this. So Hervé, he has another question.
Yeah. Thanks for the presentation. So I'm not like Chris, I'm not familiar with this technique, but I was and it's a following question as Chris already asked, but I was looking at the side effect of the ultrasounds, and I found that by itself the ultrasound seems to have an effect of clearance of the beta amyloid, so without any injection of medication. So I was wondering if they discuss about it or did they try? Because when you look at the graph, you are missing one experiment, which is the ultrasound alone. So I was wondering if that is something they discuss.
Yeah, sorry if I wasn't clear with this. They do just briefly mention it in the discussion because yeah, it's very short. But they say that other studies only with the ultrasound are able to reduce up to 6.6%. So and they use a specific measure. This is not the centiloids. This is the standardized uptake value ratio, and this calculated for this study is a 32% reduction.
Okay, I didn't.
So it is, yeah, it is much larger.
Okay. Thanks.
Yeah, I'm missing the data on what is the reduction, the standard reduction only with this, which I guess they can take from the other side, but I think it still would be bigger than the sum of the parts, let's say, the interaction.
Okay.
Right.
Thank you.
Lilith.
Hello again.
Hello again.
Yeah, it's just a little comment / question following Chris's question. So basically, as far as I know, some elderly people, they might have amyloid plaques but still be healthy. So how are they? Why? I don't know. How do they know that this amount is actually healthy or unhealthy, or these amyloid plaques are damaging or not damaging? So maybe that's why there was one of the measures.
Is it? I don't know if it was my Wi-Fi, but I lost you for there.
No, I think it's my Wi-Fi.
Yeah, we lost you for a few seconds, Lilith.
So what I was saying is that probably they just cleaned it too much, because there was one of the behavioral measures, as I understand, that was that declined. So maybe that's the reason that actually we need some level of amyloid plaques, but I don't know why and what are they doing. So
yeah, sorry.
No, I just wanted to ask related to the question, but when did they measure the neuropsychological abilities? It was immediately after the treatment, or like the 6 months after, or?
I think they're measuring it throughout the treatment and also in the follow-up phase. Yeah.
Okay.
But yeah, indeed, we don't really know that these plaques are what's causing it. It can be that other things are impeding the just cleaning of the brain, and then we see this accumulation, and it's more like a consequence. But maybe that is also why such a reduction is suddenly causing behavioral changes. It's an ongoing debate, I would say, from what I have heard.
And also just to, it's related also with the debate, this impairment or decrease in the neuropsychological test was only for one patient, right? Okay, so it's only one
Yes.
case. Okay.
Only one of the three, and in one of the different screenings they did, because
Okay.
they're listed here.
So yeah, I guess they cannot make like stronger conclusions from only one case, I guess. It's difficult
And
to...
all the complaints were of this participant 3, which was also the one with the largest decrease. But participant 3, I don't remember how. But they also complaints of neck pain, complaints of the behavioral. So it can also be, at this level, only 3 people, you don't know if someone is just more introspective or they are more observative and they report more more things, and the others are, no, it's all fine. So we don't know. Yeah.
And the last question from my side, finally.
Okay.
So is it a part of a clinical trial, or is it going to be or they're soon starting clinical trials using this method, or do they talk something about it?
No, that I read, I don't think they mentioned if this is a part of a bigger trial. They tried to recruit 4 people, and then they only had 3. That's what they mentioned, and that there is already a plan to follow them up for 5 years, but there's no mention of if it's within a larger cohort or anything. But given these results, they might be able to actually get it to be a trial.
Okay.
Then the question is more like, is it really helping? We put you through this and we get your levels lowered, but then what are we doing with that? So
Yeah. Well, thank you so much.
you're welcome. I think I missed from your previous question, you were asking how they know what is a normal level of the beta amyloid or not. Because this centiloid scale is built on, so 0 is the mean of this level that we see for healthy people, and then they take the average level in Alzheimer's people, and that is 100.
Okay.
So it doesn't mean that if you have this, you have Alzheimer's, but it means that if you have Alzheimer's, you likely have this level as well.
Okay.
Sorry, I forgot to answer that part.
No worries.
And before conclude, I have a last question. But probably you mentioned it. Was the location and the amount of medicine the same for all the 3 participants, or they use based on some specific data, they use different locations and amount of medicine?
I think the locations were the same because they're highlighted
Okay.
the same in all of them. It's just maybe a different side, but otherwise, And for the amount of medication, I do know that they were escalating this. So this is slow. So there was dose escalation, but it depends on body weight. So it will be different per participant. Yeah.
Okay. Cool. Thank you. So thank you very much, Eva, for presenting this amazing paper. And so I think there's no more questions. It's 10 a.m. So we finish here, and have a very exciting week in science, and see you next week for a new Neuroccino. Bye-bye.
Bye.